Today we're going to be demonstrating the MINT lift, which is a minimally invasive non-surgical thread lift. Determination of proper patient selection is paramount for success and is based on a number of factors: contour deficiency, facial and mid-facial ptosis, to conventional and more invasive facelift procedures, dissatisfaction of facelift results, multifactorial aging stigmata, brow ptosis, and submental, as well as prominent nasolabial folds. Following assessment for candidacy and associated counseling, the vectors are designed for optimal suture positioning. This is unique and customized to the individual. Next, the face is localized with a 50-50 admixture of normal saline and lidocaine 1% with 1 to 100,000 epinephrine. I prefer to utilize cannulas for infiltration of the vectors. I find this minimizes discomfort and makes the procedure virtually pain-free. The MINT sutures come in two varieties: the 43 centimeter bidirectional suture and the 17 centimeter unidirectional suture. The 43 centimeter suture is ideally suited for management of mid-facial and jawline ptosis, utilizing temporal fascia as a point of suspension, allowing for strong fixation. The hairline is parted, allowing for easy access to the temporal region. Next, the 43 centimeter suture is introduced with a U-shaped needle with attention on attaining superficial temporal fascia purchase for optimal strength and fixation. Next, utilizing a long needle, the suture is passed through its respective entry and/or exit points on the skin and advanced down the pre-designed vector. A second option utilizes a cannula for ease of introduction of the suture. Once proper positioning has taken place, the soft tissue is advanced in a cephalic direction, allowing for optimal lift. The distal suture is then trimmed at the skin, with any residual dimpling being gently massaged out. In contrast, the MINT 17 is a unidirectional barbed suture. The use of the cannula allows for ease of introduction of the suture into the soft tissue. Multiple vectors can be addressed from a single entry point, allowing for complex lifting strategies. In this particular patient, a modified brow lift was designed. A port site was initially made for cannula introduction. The cannula is then introduced in a suprafrontalis plane along the desired vector. Once the cannula is positioned, the suture is introduced and advanced to its ideal position. The cannula is then gently disinserted. Cephalic massaging is then performed to allow for ideal brow positioning. The suture is then trimmed at the skin surface. This was a MINT 43 patient where I utilized 3 suspension sutures per side. Procedure time was approximately 30 minutes. A second patient, again receiving 3 MINT 43 suspension sutures per side for softening of the nasolabial folds, jawline, and optimization of the malar eminence. This concludes our presentation of the MINT 43 and MINT 17 suture suspension techniques.